by the Deputy Mayor of London, Councillor Josh Morgan, and the Medical Officer of Health at the Middlesex-London Health Unit, Dr. Chris Mackie. Welcome to the media in attendance this afternoon. And a quick reminder to submit your questions using the question forum here on Microsoft Teams. And when you do, if you could include your name, as well as your media outlet and who your question is directed to. And we've already got a lot of questions in queue, so we'll get there as fast as we can. And welcome to those tuning in this afternoon on Rogers Television, as well as the Rogers Facebook page and YouTube channel, listeners on Global News Radio, AM 980 CFPL, and those who are watching on the CTV London website. Well, let's get to those opening remarks right away, and we'll start with Deputy Mayor Josh Morgan.
Well, thank you, Dan. Good afternoon, everyone. Obviously, the major focus over the past 24 hours has been St. Patrick's Day. Overall, I think it was a relatively positive day. I'm proud that, for the most part, the vast majority of Londoners celebrated responsibly, whether at home or in a local pub or restaurant. I want to acknowledge the efforts of local businesses and staff who did great work to ensure that their environments were safe and that health and safety protocols were being observed. I also want to recognize police, fire, EMS, as well as staff within the City of London and the Health Unit for their collective efforts focused on keeping Londoners safe. Despite the generally encouraging signs, there were a few isolated instances of troubling behavior. London police are still investigating a few occurrences, and I don't have any detail at this point about charges or fines. I can say, for those individuals who chose to host or attend gatherings that exceeded our current restrictions, that behavior puts not only you and your friends at risk, but also your family and the community, as COVID-19 is not only present in London, but case counts seem to be tracking slightly higher. Ultimately, that's what really matters here, case counts. And by that measure, we won't really know whether St. Patrick's Day was a success or a potential tipping point for another 7 to 10 days when potential infections might become apparent. That said, I remain hopeful and optimistic. With St. Patrick's Day now behind us, we must remain responsible, maintain our vigilance. We just officially opened a new vaccination center at the North London Optimist Community Center. We're vaccinating as many people as possible and as quickly as possible, subject to vaccine availability. As Dr. Mackie said a few weeks ago, we're in a race against variants, and right now, trying to vaccinate as many vulnerable Londoners as possible before a third wave takes hold. In addition to vaccines, our own behavior matters at least as much, if not more, in this effort to keep as many people safe from potential infection. That should remain our primary focus over the coming days, weeks, and months to come. So stay vigilant and keep doing the right thing. And as we progress, we'll get through this together. I look forward to the questions today. With that, I'm going to throw it over to Dr. Mackie, who I think is next on the list.
Thank you very much, Mr. Deputy Mayor. Yes, so we did have another significant day of cases yesterday, 28 cases. People who have been vaccinated with at least one dose. The other thing that we need to talk about right now is potentially opening up vaccinations to the population of people between age 75 and 79. We may be able to do that as early as next Thursday. We're still working through details with partners. Population between 75 and 79. We will confirm that on our briefing on Monday afternoon. In the meantime, we're highly encouraging everyone in that population to go to the vaccine booking website familiarize themselves with how to use that website and or find whatever help they might need from a friend, family member, neighbor who might be able to help them get that booking. We will be opening phone appointments at some point, but we will go to online appointments first. It's a much more efficient system. It takes people minutes instead of many, many dozens of calls to try and get through on the phone line. And it's proven very effective at booking a large number of people very quickly. So we're encouraging anyone in the 75 to 79 age group to go to www.covidvaccinelm. LM.ca. That's COVID vaccine LM for London Middlesex.ca. Check the website out, become familiar. The health card issue came up in our last round where you enter the numbers, you don't enter the digits. There are those sorts of things you'll want to test out and or have somebody help you with. The province is now trying to move everyone forward at a pretty similar rate.
Thank you very much. Our next question comes from Jennifer Beeman at the London Free Press. Dr. Mackie, how many
So essentially, the province is now trying to move everyone forward at a pretty similar rate.
Thank you very much. Our next question comes from Jennifer Beeman at the London Free Press. Dr. Mackie, how many vaccine doses have been administered
in the region sometime today? We're vaccinating between 1,500 and 2,000 people per day. That's a little bit this week because we actually pushed a lot of the vaccine forward over the last week or two to make sure we were getting as much of our, what was in the fridge and freezer into arms as quickly as possible. And so we have a little bit of a lull right now that will pick up next week as more supplies become available.
And I think Jennifer's got a follow-up question. Dr. Mackie, what have you learned from the Agriplex and Mount Bridges sites? How are these lessons helping to shape the North London Optimist Community Centre and Earl Nichols vaccination clinics?
Yeah, so one of the biggest lessons recently was around how to make sure that we have the booking system available and operating so that people can get booked as quickly and easily as possible. And that's part of why we are giving people advance notice around, the 75 to 79 age group to check that website out, and why we will be also delaying opening those appointments to the phone systems until later, probably a few days later. So really encourage people to use that website. It's just a much better way for everyone to book. The parking issue has been an important one. With the large volumes of people coming and going constantly, especially at the Agriplex, we've had a number of issues with parking and some small, accidents in the parking lots. That's one of the reasons why at the North London Optimist Centre, we've established an additional parking lot at the Stronach Arena and a shuttle bus system to get people back and forth between those two facilities. That should help with reducing congestion at the North London Optimist Centre itself.
Thank you very much. Next question. One more from Jen Beeman. Dr. Mackie, were there any missteps in executing the first two mass vaccination sites? How are these being corrected with the rollout of NLOC and Earl Nichols? And you mentioned a couple there, but one in particular was the parking, which has been addressed. Have there been any other sort of things that have jumped out?
Well, there was a day a week or two ago that definitely sticks out. That's where security guards, and you know about this, Dan, were asking the media not to attend the outside of the clinic. This is a public facility. Media wasn't planning to go inside. So we were able to work with the LHSC folks that were managing the security guards to make sure that it's clear that it's appropriate for the media to be videotaping, interviewing those that are willing to as they come and go from that facility.
Thank you. Yes, that was one I remember from, not so long ago. Next question, actually, Dr. Mackie, is from Elaine Peterson at the Western Gazette. And Andrew Graham at Global News Radio AM 980 had a similar question, so we'll try to combine these. Dr. Mackie, are there any new cases associated with the outbreak connected to student parties?
Yeah, so just a handful of new cases this week. We've had, so I believe it was Monday, we reported 45 total cases, big jump as we tested all the close contacts of the people involved in those parties. We're now at 49 cases. So that, again, we're seeing not a lot of evidence of spread once the issue was detected and control measures put in place.
Next question is from Jennifer Beeman again. Dr. Mackie, are you encouraged by the news the United States could loan Canada 1.5 million doses of the AstraZeneca vaccine? What will an increase of these more refrigerator stable doses mean for the local rollout?
It's absolutely encouraging to see less sort of vaccine nationalism happening and more collaboration between countries. I mean, US and Canada are as close as you can get in terms of countries, in terms of travel, trading, etc. We're obviously, it's in everyone's best interest for everyone in the US and Canada to be vaccinated. So not surprised to see that change of heart with the new administration there. And AstraZeneca availability makes a big difference. And when you look at difficult challenges like how do you vaccinate people that are homebound, can't necessarily come into a clinic, having a vaccine that is more stable and can be taken out in single doses for house calls through community care or through family doctors who do house calls, that really helps to reach a marginalized population that would otherwise have a lot of trouble accessing the vaccine.
you very much, Dr. Mackie. The next question is again from Jennifer Beeman, and this one, I'm not entirely sure I understand, but I'm going to ask it. So here we go. Dr. Mackie, Moderna doses are better suited to pharmacy or primary care delivery than the Pfizer doses. The North London Optimist Community Centre Clinic is administering this vaccine. Will some supply be made available to primary care or home care providers in order for them to administer it?
Well, the short answer is yes. We are in the process of working now with pharmacies, primary care providers. It looks like the pharmacies will get AstraZeneca directly through the provincial government. This is what we're kind of learning right now, and primary care may as well. But we're definitely working certainly with primary care and home care providers to make sure that we can get them Moderna. It isn't just a matter of distributing the vaccine. You do have the issue of end-of-day doses, which are much easier to handle in a large clinic, where once you've opened a vial, you've got 6 hours to administer, and we don't want to be in a situation where small clinics are only able to vaccinate 2 or 3 people and have to waste some doses. So that's got to be addressed. The clinics need to have a plan in place for those doses. And then the other hurdle is around the provincial vaccine tracking system, which is called COVAX. And the province has been very clear that people absolutely have to use this provincial tracking system. And there are a few implementation issues there. The provider has to have login credentials, obviously, which is a process to set up. But you've also got to designate a certain lot of the vaccine to a certain facility to make sure that the system knows what people are receiving in those facilities, and that takes time, and there isn't a easy process yet to set that up. So right now what's happening across the province in about 6 jurisdictions is pilot testing with primary care and pharmacies to see what the best models are there. We're looking closely at that, and also in discussions actively with local partners.
Thank you, Dr. Mackie. And I'm wondering if I could ask a question, because Jen makes a statement in her question about the Moderna vaccine being better suited to pharmacy and primary care delivery. And we know that that's one of the vaccines that is temperature sensitive, much like the Pfizer vaccine. What is it about the Moderna vaccine that might make it better suited to those applications?
Yeah, the big difference with the Moderna vaccine is that it is fridge stable for around a month. So the Pfizer vaccine has to be stored essentially at all times in the ultra low temperature freezers. Moderna is transported at ultra low temperature and stored in large amounts in ultra low temperature. But once the vials are warmed up to fridge temperature, they can be kept for a month, which makes it much easier for a primary care center to receive shipments, store them, and avoid wastage. You still do have the issue that once those vials are opened, they have to be used within 6 hours.
Great, thank you for that clarification. We are getting down towards the end of the questions, so if you have been waiting to submit your question, now would be a good time. We've only got a couple left, so if you do have those questions and you have not yet submitted them, please do send those in. Another question from Elan Peterson at the Western Gazette. Acting Mayor Morgan, this one is for you. Were any charges laid over St. Patrick's Day? And you mentioned that you're still getting some information about that. And to Dr. Mackie on this as well, overall, how do you feel St. Patrick's Day went? So Deputy Mayor Morgan, let's start with you.
Yeah, so thanks for the question. Just so you know, the city and the London Police Service just issued a joint release. So I'm going to share with you some information from that, but you'll be able to find it on both those sites. Overall, Chief Williams said up until this point, they had been responding to issues of large gatherings. But when St. Patrick's Day came around, the response shifted to primarily issues related to noise complaints, and that Londoners were generally following the provincial guidelines when it came to gathering limits. And so he certainly said he was thankful for that. Essentially, we responded to a total of 48 complaints in relation to noise, parties, or gatherings. a number of warnings were issued in relation to the Liquor Licensing Act and other bylaw-related infractions. Our bylaw officers inspected 26 restaurants and establishments. They were all checked and all were in compliance. There were 2 charges issued in relation to Liquor License Act offenses. There are investigations ongoing by the London Police Service into possible reopening Ontario Act offences, but further information on those will be provided as it becomes available. And then the police also reported that 6 patients were treated for non-life-threatening injuries related to St. Patrick's Day activities. So that's a little bit of details on the numbers. You can get more information on the release that we just put out with LPS on both of our websites, and I think that addresses your question, so thanks for it.
Thank you, Mr. Deputy Mayor. Dr. Mackie, any thoughts about how St. Patrick's Day went?
Well, I mean, if you look back to previous St. Patrick's Days, you know, in 2012, we had a riot with like car fires and everything. We just had a very, very mild Wednesday evening compared to previous St. Patrick's Day. So really huge credit to our community. People took the COVID issues seriously, and we didn't see an enormous amount of problematic activity. Certainly understand and empathize with those who had, you know, noise issues in their neighborhoods, but we'd much rather that people are partying loud than people are partying in large groups. So from a COVID perspective, pretty happy.
Thank you very much. And let's go to our next question. And right now, this is the final question, so last call. Andrew Graham at Global News Radio AM 980 CFPL is asking Dr. Mackie, has the province provided an indication whether Middlesex-London will move from its current position in the color-coded COVID response framework?
Yeah, so the Office of the Chief Medical Officer of Health at the province has not reached out this week, which is generally an indication that they are not looking for a change in our color code. Of course, these are always cabinet level decisions and lots of factors go into them. But at this point, we're not aware of an expected change to the color code system.
All right. Thank you very much, Dr. Mackie. Thank you, Deputy Mayor Morgan. That actually brings us to the end of our questions for this afternoon. I'd like to thank both of you for your time, and to you for joining us as well for this virtual media briefing. We will be back with our next virtual media briefing next Monday at 2 p.m. We hope to see you then. Between now and then, have a great rest of your day and a great weekend. So long for now.